morning, everyone. My task is to lecture to you about the hyoid bone and the muscles of the neck. The hyoid bone is a mobile single bone found in the midline of the neck. It is below the mandible and it abides the larynx. This is the hyoid bone in relation to the neck. It is below the mandible and it is superior to the thyroid cartilage. The hyoid bone does not articulate with any other bone. The hyoid bone is U in shape. It consists of a body. This is the body of the hyoid bone. Two greater and two lesser horns. It is attached to the skull by the stylohyoid ligament and to the thyroid cartilage by the thyrohyoid membrane. This is the hyoid bone. The lesser horn of the hyoid bone. And this is the styloid process of the temporal bone. So connecting the two structures are the stylohyoid ligament and the stylohyoid muscles. So between the hyoid bone and the thyroid cartilage is the thyrohyoid membrane. The hyoid bone forms a base for the tongue, and it is suspended in position by muscles that connect the hyoid bone to the mandible. So via the digastric and the mylohyoid muscles. The hyoid bone is connected to the styloid process of the temporal bone via the stylohyoid muscle, and the thyroid cartilage by the thyrohyoid muscle, and to the sternum via the sternohyoid muscle. It's also connected to the scapula via the omohyoid muscle. We will discuss later the important muscles attached to the hyoid bone. The muscles of the neck may be categorized as the superficial muscles of the neck, the suprahyoid and the infrahyoid muscles, the anterior and the lateral vertebral muscles. This is the superficial muscles of the neck. There are two platysma. So the platysma originates from the deep fascia of the anterior chest wall. It is attached to the body of the mandible and the angle of the mouth. This muscle is located subcutaneously in the neck. The suprahyoid muscles are the anterior and the posterior belly of the digastric, the stylohyoid muscles, the mylohyoid, and the geniohyoid muscles. While the infrahyoid muscles are the omohyoid, the sternohyoid, the thyrohyoid muscles, and the sternothyroid muscles. This group of muscles are also referred to as the strap muscles of the neck. This is the anterior and the lateral vertebral muscles. The anterior is scalene muscle, the middle scalene, and the posterior scalene muscle. Of these three, the anterior scalene is the most important because it serves as a landmark to identify and divide the subclavian artery into three parts: the first part, second, and third part. On the anterior part of the scalene muscle is the phrenic nerve is located, and also posterolateral to it is the brachial plexus. This is the brachial plexus. This is the subclavian artery. These are the different group of muscles found in the neck. The key muscles of the neck, the number one is the sternocleidomastoid muscle. When the sternocleidomastoid muscle contracts, it appears as an oblique band crossing the side of the neck from the sternoclavicular joint to the mastoid process of the skull. Sternoclavicular to the mastoid process of the skull. It divides the neck into anterior and posterior triangles. This is the sternocleidomastoid muscle, dividing the neck into an anterior and posterior triangle. This is the anterior triangle of the neck. It is bounded anteriorly by the midline of the neck. Midline, anteriorly midline, superiorly the body of the mandible, and posterolaterally by the anterior border of the sternocleidomastoid muscle. The posterior triangle of the neck is bounded anteriorly by the posterior border of the sternocleidomastoid muscle, posteriorly by the anterior part of the trapezius, and inferiorly by the clavicle. The anterior border of the sternocleidomastoid muscle covers the carotid arteries, the internal jugular vein, and the deep cervical lymph nodes. This is the sternocleidomastoid muscle. This one is with the investing layer of deep cervical fascia. So the sternocleidomastoid muscle covers or protects the internal jugular vein and the carotid vessels. This is the cross-section of the neck. The sternocleidomastoid muscle protecting the internal jugular, the carotid artery. And posteriorly located is the vagus nerve. Another important muscle in the neck is the Scalenos anterior muscle. The Scalenos anterior muscle is a key muscle in the root of the neck. It is deeply placed and it descends almost vertically from the vertebral column to the first rib. So the Scalenos anterior muscle originates from the transverse process of the 3rd, 4th, 5th, 6th cervical belt fibra, and it is inserted into the first rib. Important relations of the muscles anteriorly, it is related to the carotid arteries, the vagus nerve, the internal jugular vein, and the deep cervical lymph nodes. Also related anteriorly are the transverse cervical and the suprascapular arteries, and the prevertebral layer of deep cervical fascia which binds the phrenic nerve to the muscle. So related posteriorly are the pleura, the origin of the brachial plexus, the second part of the subclavian artery, and the Scalenos Medius muscle. This is the Scalenos anterior muscle. So related anteriorly, these are the important structures. The phrenic nerve, which innervates the diaphragm. And the muscle divides the subclavian artery into 3 parts. Medial to the muscle is the first part of the subclavian artery. Posterior to the muscle is the second part, and lateral is the third part of the subclavian artery. Superolateral to the muscle are the cervical plexus. And posterior to this muscle also are the origin of the brachial plexus. Medially, the vertebral artery and vein and the sympathetic trunk. And on the left side, related to the medial border, is the thoracic duct. Laterally related to the muscle are the branches of the cervical plexus, the roots of the brachial plexus, and the third part of the subclavian artery. These are the muscles, the summary of the muscles of the neck. The first one is the platysma. The platysma originates from the deep cervical fascia over the pectoralis major and the deltoid muscles. So it is inserted into the body of the mandible and the angle of the mouth. So it is innervated by the cervical branch of the facial nerve. The action of the muscle is to depress the mandible and the angle of the mouth. The sternocleidomastoid muscle originates from the manubrium sterni and the medial third of the clavicle. So it is inserted into the mastoid process of the temporal bone. The nerve supply is from the spinal part of the accessory nerve and C2 and C3. The action of the muscle. Contraction of two muscles acting together extends the head and flexes the neck. If one muscle contracts, it rotates the head to the opposite side. The digastric, the stylohyoid, the mylohyoid, and the geniohyoid are the suprahyoid group of muscles. The posterior belly of the digastric, its origin is from the mastoid process of the temporal bone. It is inserted into an intermediate tendon, which is held to the hyoid bone by a fascial sling. The nerve supply is from the facial nerve. The action of the muscle, it depresses the mandible if the larynx is fixed, or it elevates the hyoid bone if the mandible is fixed. The anterior belly originates from the body of the mandible, and it is inserted also into the intermediate tendon, held to hyoid bone by a fascial sling. The nerve supply is from the nerve to the mylohyoid muscle. But the stylohyoid muscle originates from the styloid process of the temporal bone, and it is inserted into the body of the hyoid bone. Nerve supply is from the facial nerve, and the action of the muscle is to elevate the hyoid bone. The mylohyoid muscle originates from the mylohyoid line of the body of the mandible, and it is inserted into the body of the hyoid bone and the fibrous raphe midline. The nerve supply is from the inferior alveolar nerve. The action of the muscle is to elevate the floor of the mouth and the hyoid bone, or to depress the mandible. The geniohyoid origin is from the inferior mental spine of the mandible. So it is inserted into the body of the hyoid bone. The nerve supply is from the first cervical nerve. The action is to depress the mandible or to elevate the hyoid bone. The sternocleidomastoid muscle belongs to the infrahyoid group of muscle, or the strap muscles of the neck. So origin from the manubrium sterni and the clavicle. It is inserted into the body of the hyoid bone. The nerve supply is from the ansa cervicalis, C1, C2, and C3. The action is to depress the hyoid bone. The sternohyoid origin is from the manubrium sterni. So it is inserted into an oblique line on the lamina of the thyroid cartilage. The nerve supply is from the ansa cervicalis, C1, C2, and C3. The action is to depress the larynx. The thyrohyoid muscle Origin is from the oblique line on the lamina of the thyroid cartilage, inserted into the lower border of the hyoid bone. Nerve supply is from the first cervical nerve. The action of the muscle is to depress the hyoid bone or elevates the larynx. While the omohyoid, the inferior belly originates from the upper margin of the scapula and the suprascapular ligament. It's inserted into an intermediate tendon, which is held to the clavicle and first rib by a fascial sling. So the nerve supply is from the ansa cervicalis, C1, C2, and C3. So the action of this muscle is to depress the hyoid bone. Superior belly originates from the lower border of the hyoid bone and it's inserted into the intermediate tendon. The vertebral group of muscles, the Scalenos anterior, origins from the transverse process of the third, fourth, fifth, sixth cervical vertebra, inserted into the first rib. So nerve supply is from C4, C5, and C6. The action of the muscle is to elevate the first rib. Or if the first rib is fixed by contraction of the intercostal muscles, the muscle laterally flexes and rotates the cervical part of the vertebral column. Another muscle is the Scalenos Medius, so originates from the transverse process of the upper six cervical vertebra, inserted into the first rib. Nerve supplies from the anterior rami of the cervical nerves. So the action is the same, elevates the first rib, and if the first rib is fixed, it laterally flexes and rotates the cervical part of the vertebral column. While the Scalenos posterior muscle originates from the transverse process of the lower cervical vertebra. So it is inserted into the second rib. The nerve supplies from the anterior rami of the cervical nerves. So the action of the muscle is to elevate the second rib or laterally flexes and rotates the cervical part of the vertebral column. So this is the Scalenos anterior muscle inserted into the first rib, as well as the middle scalene muscle, while the posterior scalene muscle is inserted into the second rib. Posterior view of the lateral vertebral muscles, the Scalene, Scalenos Medius, and Scalenos posterior muscles. Scalene anterior, middle Scalenos, and the Scalenos posterior muscle. For the clinical notes, clinical identification of the platysma. The platysma can be seen as a thin muscle just beneath the skin by having the patient clench his jaws firmly. So this muscle extends from the body of the mandible downward over the clavicle into the anterior chest wall. So, in surgical incisions of the neck, it is very important that the subcutaneous layer with the platysma be carefully sutured, since the tone of the platysma can pull on the scar tissue, resulting in a broad and gaping scar. So if you fail to repair the muscle, so the scar would appear as a wider and a gaping scar. For the platysma innervation and mouth distortion, the platysma muscle is innervated by the cervical branch of the facial nerve. So this nerve emerges from the lower end of the parotid gland and it travels forward to the platysma. It sometimes crosses the lower border of the mandible to supply the depressor anguli oris muscles. So skin lacerations over the mandible or upper part of the neck, as well as injury to the nerve, may distort the shape of the mouth. So this is the cervical branch of the facial nerve innervating the platysma muscle, as well as the angle of the mouth. So, paralysis or injury to this nerve may result in this type of deformity. For the sternocleidomastoid muscle, the sternocleidomastoid muscle is a strong, thick muscle crossing the side of the neck. So it protects the underlying soft tissue structures. So it protects the carotid arteries and the jugular veins from trauma. So the common sites for the wound in the neck is immediately above and below the hyoid bone. So in this part of the neck, the sternocleidomastoid muscle is parang widely separated from each other as compared to the lower part of the neck. So for the clinical conditions, number one is the congenital torticollis. The second one is spasmodic torticollis. For the congenital torticollis, most cases are a result of excessive stretching of the sternocleidomastoid muscle during a difficult labor. So hemorrhage occurs into the muscle and may be detected as a small rounded tumor during the early weeks after birth. These hemorrhages become invaded by fibrous tissue which contracts and shortens the muscle. The mastoid process is pulled down toward the sternoclavicular joint of the same side. So the cervical spine is flexed. The face looks upward to the opposite side. So if this condition is left untreated, asymmetrical growth changes occur in the face and the cervical vertebra may become wedge shaped. So this is the deformity in patients with congenital torticollis. For the spasmodic torticollis, this results from repeated contractions of the sternocleidomastoid muscle and the trapezius muscles. It is usually a psychogenic in origin. Sometimes sectioning of the spinal part of the accessory nerve may be necessary in severe cases. I think that's the last slide. Okay. Do you have questions or clarifications? Morning.
Morning, Doc.
May question ba kayo regarding sa topic?
Wala na po, Doc.
So, I will just send a copy of my PowerPoint to you. My next lecture is about the oral cavity and I'm scheduled on March 23. So, maybe ma-reschedule din natin kasi usually may mga activity kami sa Tuesday or Monday. So, pwede natin gawin the same time, Thursday or Friday afternoon kung may time kayo.
Sige po, Doc.
Okay. May attendance ba tayo?
Meron po.
Okay, sige.
Thank you, Doc.
Thank you.
Thank you, Doc.
Thank you.
Thank you, Doc.
Thank you po, Doc.
Thank you, Doc.
Thank
Thank
you,
you,
Doc.
Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.